So international trade statistics are concerned with the export and import of goods and services between countries. In theory, partner country reports of the same trade flow should match. So for example, UK exports to Germany, those reports should match the reports from Germany of their imports from the UK. In practice, however, differences exist, which are known as asymmetries. Today, I'm going to give you a little bit of context for why looking at asymmetries may be a little bit complex due to the different measurement approaches and concepts of looking at trade statistics, present some headline descriptive statistics from a recent trade publication of ours, and then introduce a model of reconciling trade asymmetries. So this model has been put together by a leading US academic known as Tom Baranga, who works in Harvard. The model is very much Tom's work, produced in collaboration with us. So I'm happy to take any questions on the model, but any very specific questions you might have, I'm more than happy to follow up when I'm back in the office. Understanding the impact of trade asymmetries is just one part of a large project that we're undertaking at UK Trade at the ONS. We're looking at lots of different aspects of improving trade data sources and methods, and understanding the impact of trade asymmetries is quite an important part of that. Understanding trade asymmetries will be important in relation to all our major trading partners, but maybe most important for these guys here. So the US, Ireland, Germany, Netherlands, France, China, and Belgium, Luxembourg are our major trading partners for trade in goods. According to our statistics, for 2016, we held a trade in goods surplus with the US and Ireland, so we exported more to these countries than we imported from them. They're key market destinations for us. We hold a trade in goods deficit with remaining countries, so we're reliant on their imports, so we would benefit from having good trade agreements with these countries in the future. We deal in the ONS with trade in both goods and services, so goods like mechanical machinery and services like financial services. Today, I'm just going to present data on trade in goods. Trade in goods data is more tangible, it's easier to measure, so it's a good starting point with which to look at trade asymmetries. We get our trade in goods data from HMRC. So HMRC compile their trade in goods data on what we refer to as an OTS basis, Overseas Trade Statistics basis. So HMRC records their data through customs duties, essentially. This means they're interested in movement across borders, so they record where the good physically is. If a good crosses a UK border going out, it's recorded as an export. If a good crosses the UK border coming in, it's recorded as an import. By convention, imports recorded on an OTS basis include the value of cost, insurance, and freight associated with their import, whereas exports exclude these costs, so we refer to exports as being measured on a free on-board basis. However, at the ONS, we want to record our trade in goods data on a balance of payments or BOP basis. So as well as being interested in what side of the border a good physically is, we're also interested in who economically owns those goods, so who's responsible for the risk and who receives the reward in a transaction. So in order to transfer our data that we receive from HMRC on an OTS basis to a balance of payments or BOP basis, we have to apply certain adjustments to those data. It's a balance of payments type data that contributes to our gross national income, so that's why we're interested in data on this basis. All countries that compile their data on a balance of payments basis, which is the majority of countries, need to apply these adjustments. And obviously, international standards and regulations exist, but there are differences and variation between countries in the application of these BOP adjustments, which is just one source of asymmetries between countries, more of which I'll talk about in a minute. So, asymmetries. Having asymmetries with other countries in terms of your trade stats is very much a global phenomenon. Despite the attention that UK trade sometimes receives in the media, we are far from alone in having asymmetries. Typically, the convention has been maybe just to ignore asymmetries or perhaps to prioritise your import over your export reports. Trade tariffs are overwhelmingly levelled on imports rather than exports, so importers are seen as being under that additional incentive to accurately record their trade. However, if you don't want to just ignore your asymmetries and you don't want to potentially bias your sample just by looking at imports, there are a couple of statistical approaches you can take to measuring asymmetries. The first is absolute asymmetry, which is calculated on an export and import basis. So it's just the difference between the value of trade provided by the declarant company or country. So for example, UK reports of their exports to Germany, less the difference of the report provided by the partner country, so Germany's reports of their imports from the UK. In absolute terms, these values can run to the order of billions, so they can look a little bit intimidating. However, taking absolute asymmetry as a proportion of total bilateral trade or relative asymmetry, here at the bottom, these values are much more manageable, so quite a lot more easy to interpret. Total asymmetry, there we are, is the calc that Eurostat prefers to use. So this is the sum of the absolute export and absolute import asymmetry. So exports and imports are summed together without regard to their sign, so there's no netting off. So obviously these can be pretty large again. I've mentioned that trade can be measured on both an OTS and a BOP basis, both of which are completely valid, but obviously leave you then with a decision as to what sort of data set you should compile when you actually want to look at trade asymmetries. Obviously, we would like to choose data from our partner countries that has been compiled on the same basis as ours on a BOP basis. That's a little bit tricky to do. As I mentioned, there's variation in the application of BOP adjustments, and it's difficult to get an aggregate BOP data set. So for the headline statistics I'm about to show you, I took data from the UN Comtrade database, so HMRC, which sends OTS data to us, so trade that is recorded in terms of movement across borders. HMRC also send the same data to the UN, as do about 170 other countries throughout the world. So the UN Comtrade database represents the largest aggregate trade and goods database that we can access, in which country data is presented in US dollars. I'm going to step back a little bit so I can see. So this table shows trade and goods asymmetries for the UK in UN Comtrade data for 2014 in dollars billion. So here we have those major trade and goods trading partners that I've already presented to you on the other figure. We have export absolute asymmetry, which is the difference between our reports of our exports to the US and the US's reports of its imports from us, similarly for France, China, etc. Import absolute asymmetry, the difference between our imports from the US and their exports to us. Total asymmetry, which is the sum of the export and the import, and then the total asymmetry as a percentage of UK current account goods transactions, so relative asymmetry. So as you can see, in 2014, we had a total asymmetry of $13.7 billion with the US. So that's how much our accounts differed by. Which seems pretty chunky, to be fair. As a percentage of UK current account goods transactions, however, that's just 1.2%, which seems much more manageable. The remaining countries each account for less than 1% of current account goods transactions in terms of the size of their total asymmetry. So what sort of impact do trade and goods asymmetry have on our view of the trade and goods balance? So this figure here shows the UK and partner country view of the trade and goods balance, again using UN Comtrade data for 2014. On the x-axis here, you have the UK view of the trade and goods balance, and on the y-axis, you have the partner country view of the trade and goods balance. Put very simply, the closer those data points cluster to the diagonal, the greater the agreement between our view and the partner country view of the trade and goods balance. So the good thing is, based on this data set, we're in agreement with all our partner countries on the direction of the trade and goods balance. So the worst thing would be if we were reporting a trade and goods surplus with the US and they were also reporting a trade and goods surplus with us. But they're not, so that's good. Where we differ, obviously, is on the size of the trade and goods balance, which is indicated between the degree of discrepancy between the data point and the line. There are lots of reasons why there may be differences between exporter and importer reports of the same trade flow. Very quickly, there could be differences in declaration thresholds. So one country may say you don't need to record trade if it doesn't exceed €20,000, for example. Another country may say that declaration threshold is €25,000. So we have some discrepancies there. Confidentiality or suppression, differences in survey coverage and methodology, exchange rate fluctuations, very relevant for countries inside and outside of the Eurozone, triangular trade. So this is when, for example, a company in the UK would receive an order from a company based in France. The British company orders the good directly from a company based in Germany. The German company sends the good directly to France. Germany then bill the British company, and the British company send the invoice to France. So a good has crossed a border between Germany and France, but the UK is involved in the change of economic ownership of the good. So that's quite tricky to record. Transit trade, a good is moving from country A to country C, passing through country B, and is misallocated as going to country B. That can sometimes happen. Globalization, trade is becoming increasingly complex. It's becoming increasingly difficult to assign a single country of origin when a good can be made up of multiple parts from multiple countries. So that can be quite tricky too. Customs warehousing, this is a big one. So a good may sit in a customs warehouse for 2 to 3 months. It's been recorded by country A as an export in, say, the first quarter of the year, sits in the warehouse for a little bit, and then isn't recorded as an import into country B until 2 or 3 months later in a different quarter. So you have some kind of mismatching there. So, ideally, we would want to remove all asymmetries from our data with all our partner countries. That's probably never going to happen. Trade is becoming increasingly complex, as I said, and as soon as you resolve the source of one asymmetry, a dozen more would have sprung up in its place. You'd just be chasing your tail pretty much for the rest of your life. So if you don't want to ignore them, you can't completely eradicate them. Maybe there's a way that we can make asymmetries work for us, and that's basically the point of the Baranga model, which is still, as I said, a bit of a work in progress. So at a high level, so it's 9 o'clock in the morning, so I'm not going to hit you with any complex equations. I'm going to keep this nice and light. Tom's work is a model of reconciliation with optimal weights. So quite high level, it's a 2-step process. First is to estimate the bias and volatility of countries' reports, and then to choose weights to minimize the variance in reconciliation error. And the aim for that would be to give us an idea of who's a reliable trade reporter, how reliable is the UK as a trade reporter, and maybe to give us some rule of thumb indications in terms of reliability about where we might want to apply adjustments. It's quite far down the line and obviously would only be coming out in terms of experimental work. So step 1, estimate bias and volatility of countries' reports. First, we model the export and import reports, each proportional to the true or underlying flow of trade, subject to being potentially inflated or deflated by the reporting country's bias in reporting, so whether a country tends to exaggerate their exports and imports to make them look more robust, a trading country, or whether they tend to underreport, whether the report is filed or not, which is a big one. So that's a binary term, and the reporting accuracy or volatility. We then construct a series of fitted reporting errors for each trade report, and we use these reporting errors to estimate the average noise or variance in countries' reports. That variance is the key input in step 2, which is constructing the reconciliation weights. Reports from countries with relatively low variance in reporting error and low sampling variation in the bias corrections are prioritised. And as I said, this allows us then, or would allow us, to draw conclusions about relative reporting biases and get a feel for who's a reliable reporter and who's not, and just get a more broader picture of trade asymmetries overall. So the next 4 slides are just some early results from the model, but it is quite promising for the UK. So this is the distribution of export biases, so that tendency to inflate or deflate your export reports. The purple line here is the median export bias, and the blue line, which is just above, is the export bias for the UK. So you can see the median there is pretty flat, maybe very, very slightly negative, and the UK is very close to the median, so pretty slow or low in export bias, pretty reliable, which is really good. You can see in terms of the largest and the smallest export bias here. Similarly, for import biases, the median is maybe a little bit more negative than the export bias, but again, quite flat, quite reliable, and the UK, the blue line here, lies very close to the median. So this is really good. This means that the UK doesn't tend to inflate or deflate its export and import reports. So we seem to be, at least based on this model, quite a reliable reporter of our trade. This is export variance. So how much volatility are in our export reports. Purple line here, again, is the median. So we have a little bit more noise here. And blue line here is the UK. So we are smaller than the median, which is good. Import variance, just to bring your attention here to the scaled-in nature of this graph. So it does look like there's a little bit more noise going on, but we've just zoomed in a little bit. Median here is the purple line, and blue is the UK. So we do have a little bit more movement going on here, but again, the scale is a little bit drawn in for us, and we're looking pretty good for import variance. So those are early results. Tom needs to work out a little more kinks in the model, really, and maybe get a better feel for how do you distinguish between the variance in a country's trading reports versus the natural variance that can occur in some commodities that naturally are just a little bit volatile anyway. So that's just one of the things that we need him to work on. But as a start, it's looking pretty good in terms of reliability of UK trade reports. So future work, as I said, we'll look to think about how we might be able to take some of Tom's work, work it into some experimental results, get a feel for how trade asymmetries impact on our trade balance. Also, so far we've only looked in trade in goods, so we also need to look at trade in services, which would be a little bit more complex due to the intangibility of services data. We're also talking with the US and lots of other countries that my line manager has met this year, looking to understand the sources of trade asymmetries from a bottom-up level. In terms of our UK trade project, we're also undertaking a thorough review of all BOP adjustments, so those adjustments we apply to our data from the HMRC to take them to a balance of payments basis, and we will be sharing all our work with you throughout the next 12 to 18 months in articles. So thank you for listening, and thank you to the RSS for inviting me.
So I'd just like to begin by asking a quick question. It's not too difficult, you can have a guess. The cost of falls in the NHS in England, I understand we're in Scotland, but regarding England, what would you say is the cost of falls annually to the NHS? Any guesses? Any guesses? Sorry? 2 million? 2 billion, okay. Any
1 million.
1 million, okay. Well, the actual cost is 2.3 billion estimated. So, yeah. It was a very good, I mean, do you work in the NHS? Yeah, so, I mean, obviously it's a substantial amount of money. So the project that we were looking at was, do nursing stations within bays of hospital wards reduce the rate of inpatient falls? So due to the cost to the NHS, obviously it's a significant thing to look at. So we've done an interrupted time series analysis. So just a little bit of background. The ageing population is a challenge for healthcare systems, not just in England and Scotland and Wales and Ireland, Northern Ireland or Ireland, but globally for all healthcare systems. People are tending to live for longer, due to better treatments and due to a better quality of life. So obviously this is an issue that needs to be dealt with. Hospitals, they tend to be a high-risk environment for falls. Due to the way the hospitals are laid out, the floors for infection control, obviously they don't have carpets, so they can tend to be slippery. So they tend to be a high-risk environment for falls. And inpatient falls are a major public health burden, as we've mentioned. Falls have severe consequences at times. They can lead to a loss of independence, functional decline, and subsequent admission to long-term care. And this is particularly prevalent in the elderly population. Just to understand a little bit, so this is a picture of my grandmother. I presented the talk at YSM in Kiel a couple of months back, and she was admitted to hospital the 2 days before. She had a fall. It wasn't too serious. It wasn't in hospital. It was at home. It was only from, I think, 2 steps. But she ended up fracturing both her arms, and her jaw had to be, stitched. So, and just from a small fall. She's not that old. I mean, she's in her early 60s. So it just goes to show that as the population is aging, people tend to be more frail, and a small fall for me and you, perhaps, would not really result in anything significant, but for the elderly population, it can lead to devastating consequences, and she was hospitalized for about 2.5 weeks before being sent home, and since then she's actually been in hospital twice as a result. So as I mentioned, subsequent admission to long-term care is quite an issue. So in terms of the United Kingdom, falls are the most common cause of injury-related deaths in people over the age of 75. Each year, it's estimated that about 3.4 million, that's more than 1 in 3 people over the age of 65, they suffer a fall that can result in a serious injury or even death. And as I mentioned at the beginning, the financial burden is estimated at approximately 2.3 billion pounds per year. And this is, majority of it is due to the fractures which are caused as a result of having a fall, not necessarily the fall itself. Innovations in service redesign and interventions are regularly introduced in falls and fragility fracture prevention within the NHS. However, they are not necessarily robustly evaluated in a rigorous manner. So the objective of this study, it was actually to assess whether the trends in the monthly rates of inpatient falls changed following the introduction of the stay in the bay intervention. So in terms of the intervention, it was something quite simple. It was called stay in the bay. So the idea was that the nurses essentially stay in the bay. And to facilitate this, we had a stay in the bay portable nursing station. So for those of you who've been in hospital as patients or visiting people, you may notice that generally the nursing stations, they tend to be centrally located on the ward. So the idea of this was within each bay, we were going to introduce a portable nursing station so that the nurses can do their tasks. So essentially it was a very simple thing. It's a computer on wheels with a drawer for patient notes. And it is located within the bays, so that's the key point. And the aims of this were to increase observation and increase nurses' contact time. So obviously, as many of you are aware, the constraints within the NHS, we can't just suddenly conjure up dozens of more nurses on every ward. Ideally, we would do that, but that's not possible. So the idea was to regard it using the resources that we already have, so the nurses which are already on the ward, utilize their presence and increase the contact time that way. So not increasing the actual number of nurses, but rather increasing the amount of contact time nurses have with their patients. And this was done by introducing these stations so that the general administrative tasks or any other sort of work that they can do on their own, they could do it within the bays. So in terms of the study design, it was a natural experiment. So natural experiments use data that is already collected, and this is something which, with the NHS, obviously there's a lot of data which is collected routinely, so it is used in evaluating population-level interventions. It is a quasi-experimental design, which means it's non-randomized, where each hospital acts as its own control. And it can be a rapid and cost-effective method of providing robust feedback within the NHS. However, it should be noted that care and transparency is required when we're reporting the results of these natural experiments. Because as you can appreciate, it's not a randomized controlled trial, which is the gold standard for testing interventions. However, this is another way of looking at it. So in terms of data sources, data were obtained from the NHS incident reporting software, which is called Datix, which covers more than 90% of trusts in the UK. So the nurses, they report any fall that occurs on the ward or in the hospital using this software. It is routinely collected, as I mentioned, and it is reported to the National Patient Safety Agency by more than 98% of trusts. Data were collected on the following variables, and this is what is collected within the UK. The date of the fall, the location where it happened, i.e. which ward, the age of the patient, the gender, and the level of harm that was caused as a result. And they are split into 5 categories: none, low, moderate, severe, and death. And these categories are sort of defined by the NPSA, and they are standardly used across the UK. In terms of the study setting, so we had 2 hospitals within Buckinghamshire in England, Stoke Mandeville Hospital, which had 12 wards participating, and Wickham General Hospital, which had 5 wards participating. Wickham General is slightly smaller than Stoke Mandeville Hospital. The study period spanned over a period of from April 2014 to March 2017, So it's a period of 24 months prior to the intervention and 12 months post-intervention, so it's 36 months in total. The intervention was introduced in April 2016. In terms of the outcome that we were looking at, the outcome is the monthly rate of falls per 1,000 occupied bed days. And this is a rate which is used within the NHS to compare the fall rates across trusts, across hospitals, and nationally. The occupied bed days is the sum of the number of occupied beds for each day of that period. So we looked at the monthly rate of falls. And as I mentioned, the intervention was introduced in April 2016. So we had 2 years of data prior to the intervention being introduced, and we've been following up since. So in terms of statistical methods, it is an interrupted time series design. So ITS is a quasi-experimental design, i.e. non-randomized, to evaluate longitudinal effects through regression modeling. As you probably know, time series is a continuous sequence of observations on a population taken repeatedly over a period of time. So we have a time series, and in an ITS study, the trend which takes place over a period of time is interrupted at a certain point, which is known to us prior to conducting the analysis. And we have something called the counterfactual, which I'll come back to a little bit later, which is a hypothetical scenario under which the intervention had not occurred. And it provides a comparison by examining changes in the post-intervention trend period. So to analyze the interrupted time series design study, we use segmented linear regression. So we have segments where a sequence of measures are divided into 2 or more portions at particular points. And it is a method for statistically modeling the ITS data to draw more formal conclusions about the impact of the intervention. And there are parameters for each segment: the level, which is the value at the beginning of the time series, and the slope or the trend, which is the rate of change during the segment. And it is modeled using 3 time-based covariates. And I'll just explain in a moment what they are. So the segmented linear regression models were used to estimate the changes in the outcomes immediately following the intervention period, while controlling for baseline levels and trends. So this is the unique thing about segmented linear regression, which allows you to control for baseline levels and trends. And we estimated the effects using the following segmented linear regression model. And so this is the regression model where YT is the outcome, which is the monthly rate of falls. B0 estimates the baseline level of the outcome at the beginning of the time series. B1 estimates the pre-intervention trend. B2 represents the change in level immediately after the intervention. Beta 3 represents the change in slope post-intervention, and ET is the random variation at time t, not explained by the model. And it will become a little bit clearer in the next slide, or when I show the actual results. So just to begin with, just some descriptive results. So the total number of falls in the study period were 2,322 across the 2 hospitals and the 17 wards that participated. In terms of age, the median age was 81, so it was quite an elderly population. There was around missing data on about 10% of the patients. And gender, the majority were males, about 59% and 41% being female. And there was about 2% missing data on gender. And so also we look at the falls according to the level of harm, and this is something which is quite important to the NHS, because obviously where you have the severe and death categories, obviously we don't want any of those. So fortunately most of the falls came under no harm, which was quite good. And even amongst severe, there were only 12 in a 36-month period. So the number is really low, and there were 4 deaths as a result of fall. Yeah. So in terms of the actual interrupted time series analysis, the results, so we have the red line represents the trend prior to the intervention taking place. So we have the monthly rate of falls for each time point, each month. And as you can see, the trend is generally increasing. And it was increasing at 0.127 falls per 1,000 occupied bed days. And the red vertical line is the point of the intervention, which was April 2016. And after that, the post-intervention period, the green line represents the trend following the intervention. And after the intervention was introduced, the rate of falls was decreased by 0.437 falls per 1,000 occupied bed days. And the rate of change was 0.564 falls per 1,000 occupied bed days. And that was the difference. So this equates to an absolute difference of 4.59 falls per 1,000 occupied bed days. So the red dotted line, which, if I can, where is it? Yeah, so this dotted line here, which shows the counterfactual value, which is if the intervention had not taken place, that would have been the trend. And at 12 months post-intervention, the blue dotted vertical line indicates 12 months post-intervention. So that absolute difference was 4.59 falls per 1,000 occupied bed days, and that is a relative percentage reduction of 46.3%. So our main findings was that the study identified, following the introduction of Stay in the Bay, the monthly rate of falls decreased markedly amongst hospital inpatients. The higher proportion of fallers were males. And this is something interesting because generally females tend to make up the majority of hospital inpatients. However, amongst the older population, males appear to make up the greater proportion of hospital inpatients. However, overall, across all ages, females tend to be higher. And the median age, as I mentioned, was 81, so it's an older study population. And this agrees with published HES hospital episode statistics data regarding older age groups. In terms of strengths and limitations, the interrupted time series is a very strong quasi-experimental method for evaluating intervention effects, as it controls for secular trends and it takes into account the pre-intervention trend, which other methods do not necessarily do. One of the other strengths of this study was that the detailed information that we collected from the clinical team who developed the intervention within the Buckinghamshire NHS Trust. However, the limitations, as you can appreciate, we only used 2 hospitals and there were only 17 wards participating within one NHS Trust. So, of course, it would have been better to include more. And one of the other limitations were co-interventions. Some co-interventions were present within the trust in terms of overall fall awareness strategy. And this is something generally across the UK, especially in recent times where there's been a great push for falls prevention awareness. So things like intentional rounds where nurses go around every hour, extended visiting hours so that the patients' families and friends are present for longer so that if they need help, they can get quicker help than waiting for the nurses. Multifactorial falls risk assessments, again, that's something that's regularly introduced, and generally a higher profile of falls prevention overall in the UK. So in conclusion, this study provides evidence that the introduction of Stay in the Bay was temporarily associated with a reduction in the monthly rate of falls. And Stay in the Bay does have the potential to be applied across the NHS, and it may reduce the number of inpatient falls. Just thank you to the research and clinical teams who took part and the staff and patients who took part in the study, and thank you to the RSS for giving me the opportunity to come and speak today, and thank you all for waking up nice and early and attending. I know it might be difficult for some. And this research was funded by the NIHR Clark, Collaboration for Leadership in Applied Healthcare Research and Care in Oxford. And thank you. Any questions?
Are there any questions? Oh, that's it's working. Yeah.
Very interesting topic. Thank you. Can we look at the graph about the change?
Yeah.
Because I have seen around October in 2015, the trend became changed already. It became flat. Yep, that one. Oh.
Yeah.
Yep, this
Yeah.
one. From left to before the intervention, I can see there is a quite a strong linear increasing trend.
Yeah.
Then it came down and became flat.
Yeah.
Then there is intervention. Then it started to decline.
Yeah.
So my first question is, what happened for the flat part around October 15?
Yeah.
And also, I don't understand that there is a trend, linear trend before intervention and also after intervention. So I think you need to detrend, then look at the intervention's effect, because the linear trend is not related to the intervention. So there is some other factor making the linear trend before and after intervention. It should be detrended, then compare before and after. That would be better comparison about the intervention.
Yeah, that's a good point. So when we did the analysis, it was a priori. So the points obviously was decided prior to analyzing. So yeah, we can see that there is something going on around October 15. The thing is, we don't actually know, because it wasn't a randomized controlled trial. It was just a natural occurring experiment within the hospital. We don't actually know what caused that particular trend prior to the intervention. So one of the assumptions of this type of analysis is that we assume it's a linear trend. And yeah, so that's what we did. But that's a good point, yeah, regarding...
Okay, then another question,
Yeah.
if I can. There is no cause of hospitalization of the patient.
Sorry?
Cause of hospitalization.
Cause.
Yeah,
Yeah.
cause. So if the participating hospital is about patients who are not mobile, then there is a less chance of a fall, right? So
Yes.
I think you need to look at why they were admitted to the hospital,
yeah.
and among those, different cause,
Yeah.
the change of the fall would be good, comparison.
Yeah, no, that's definitely useful information to have. The problem with using NHS and routine collected data is that to acquire further detailed information is very difficult regarding the cause of admission. Generally, with the wards that were chosen, the 17 wards, the clinical team, they chose wards which weren't necessarily completely immobile patients. There were wards which had a high risk of falls to begin with. So that's why the intervention was targeted towards there. We did try to acquire some further information regarding more details regarding the patients, but it proved very difficult to acquire that information. But yeah, that's something that we hope to look to in the future. Thank you.
So this is work with my supervisor, Guy Nason, and a couple of collaborators, Marina Knight and Matthew Nunes. So, network time series. To start off with, here we go. We'll have a motivating example, just to sort of get a feel of it. So this data, unfortunately, does not include Scotland, but is taken on counties of England, plus a nominal county of Wales. So this data is the counts of mumps incidences in the year 2005. So 2005 was a year where there was a bit of an epidemic of mumps. It's not too long after the MMR vaccine scare, so the rates of vaccination in the population were a bit lower, so then naturally we had a few more disease incidences in the following years. So this data is, just find the pointer, there we go. Okay, I can't find it. So we've got XPT. So the vaccinations are over time, which is the 52 weeks, and also the different counties, which is the subscript P on this. So what we've got is a multivariate time series of dimension 52 weeks by 47 counties, which it's not the hugest series in the world, but it sort of gives you a flavour of what can be done. So we've got all sorts of questions we might want to answer about this. We might want to look at the trend over time, we might want to look at what different models would be suitable, and also the question of whether we can use a model to get some forecasting. So I've mentioned the word network in the title. We've got these counties, and what we want to do is construct some form of network for them. So there's lots of different options. In this case, because we have counties, we've got nice location data with it, we've got a link by geography. But you could also think of different series where you might have different things that you might want to link by. So I've recently had a look at some GDP data, and I've looked at imports. So imports between different countries might give you an indication of maybe a network there. So in this example, the counties are connected by a minimal spanning tree about over the points where the county towns are. So for example, in Staffordshire, the county town is Stafford, and that's the location on the map. And then, because that's a little bit sparse, some extra edges have been added for towns that are really quite close together. So we've got this network, and we've got these edges, and we've got a sense that maybe distance will affect. So we've got sort of a playoff between distances on the network, and also we could use this as a sub for a sort of weight across the network. And this is the example of the network all nicely connected up. So, move on to, I'm afraid to say, some formula. So this is the model at the bottom. So first off, at the top, what I've put is the standard autoregressive model for a time series. So what we've got is that our observation at a particular county at a particular time is going to be influenced by a linear combination of previous observations at that point, plus some random noise, that's the epsilon at the end. So we want to take account of our network structure. So this thing down at the bottom, the beginning of the line looks the same as the standard AR process. So we've got the same alpha parameters based on the values at that node at previous time points. So what we think is that in our network, say Staffordshire, we think that the months counts now will be influenced by previous time points in Staffordshire, but also we've added some extra terms at the end which are based on our network. So it's based on whose neighbours we have. So to expand on that a little bit, it's quite small at the top, but so we've got this example where Stafford is in black on the map, and then Stafford's neighbours are highlighted in dark blue. So a neighbour is somewhere where you can get to with one edge. Then we have second stage neighbours in kind of a gold colour, which is sort of the next band round. So second stage neighbours you need two edges to get to, and etc. We can move up through as many stages of neighbours as we like, and you can imagine that if you've got a really large graph, then you might have a lot of different edge sets you could choose. And we also want to allow a bit of flexibility in this network. So for example, if nodes drop in and out, that kind of thing, we sort of want to be able to deal with that without having to completely refit our model. So to do that, we introduce a weight parameter, the omega here. So we split up the betas, which are a set of parameters that we want to estimate, with the omegas which we get from our graph structure. So they're like the weights of our graph. So splitting down our model, we've got that at our current time and our current location, we think that it's going to be influenced by standard AR type model, so previous time points, same location, but also potentially previous time points at our neighbouring locations, or indeed our the rth stage neighbours. So we just sort of expand that net further and further. And then obviously we've got some noise at the end there. So these weights are connected to the distances on the graph, in that the further away something is in terms of distance, the smaller the weight would be. So sort of downweight things that are really far away. So that's our model. and we'll look back at the data set. So this data was count data, and what we first did was normalize it in terms of the population at each county, so to give a a value relative to the population level. And then previous work showed that using the log transform really helped on this data to stabilize the variance over time. So that was applied next. But I haven't dealt with it in the next few slides, but this is some sort of food for thoughts. This is the trend, the global trend over time. So the average value over all of the network points per time point. So as you can see, it's not stationary in terms of the trends. So to start with, there are more cases. Then at, say, week 20, we start a decline, and then afterwards it sort of plateaus and then declines again. So we do have this question of what we might do with some form of global trend here. So with any kind of time series analysis, here we've got some looking at the autocorrelation and the partial autocorrelation for the series. So we've got this time series, we've got lots of different time series essentially at different counties, locations. And what we can see in London is that we've got quite a triangular shape to our autocorrelation plot. So that indicates we've got quite a bit of structure happening there. If we look at the partial autocorrelation, it sort of seems like we might have an autoregressive process of order 2 maybe, because we have a spike at 2, but then it drops off very quickly. So if you're unfamiliar with these kind of plots, on the top plot, we'll always have a spike at 0. But beyond that, you want to sort of stay between the blue bands. If you stay between the blue bands, there's no evidence of any sort of auto-regressive structure. So we're obviously aiming to try and capture any structure we have and then get some residuals that look really nice and like noise. So we can see that London, there's maybe some structure. The Suffolk series, there's not a great deal going on in there. And we also looked at the cross correlations, so comparing different counties to each other. And as you can see, London and Essex have a great deal of structure in common. But the other ones compared didn't so much. So these are the things we would like to deal with. So to fit the network autoregressive model, you can write it in terms of sort of like a linear model setup. So then you can fit just using least squares, that kind of thing. I've been looking into sort of the best fitting statistics for it, and I'm not really sure what the ideal or optimal statistics would be to use. Here we've got the mean residual sum of squares, the AIC and the BIC. So as you can see, it's hard to choose between the models, but for this one we've taken the NAR 220 model forwards, and the 220 means that we have the first 2 denotes 2 autoregressive time parameters. So we think that at time t, it's going to be based on t minus 1, t minus 2. And the second 2 is that we use 2 neighbor sets at t minus 1. So in the square brackets, you end up with something the same length as the first number. Okay, so taking the NAR 220 model forwards, we can have a look at the residuals from this. So I'd argue that there doesn't seem to be a great deal of much happening in any of these plots. Obviously, these are just a subsection of the counties. There's maybe some increased variation in the bottom right in the Kent series as it goes forwards, but there's nothing really obvious going on. And we then look at the same plots as before, but these are on the residuals rather than the original values. So as you can see, where we had in the first London plot, there was a clear sort of triangular shape that has now gone. So we've dealt with that structure well. And the other important thing is we haven't sort of introduced any further structure in the other series. So this is quite a big sort of danger with a model like this. You can sort of fix one county, but then introduce extra correlation in another. And we've got the cross correlations as well. So London and Essex is looking a lot better. We've still got a few high values, and we've got a few values escaping our blue lines again in the other bits, but nothing, again, nothing really concerning there. And so we can look at this model and see what it tells us. So the alpha parameters are the auto-regressive parameters, and the beta parameters are the ones based on the network. So we can see that the alpha parameters are higher, so your own values sort of are more significant than the neighbouring values. They've got higher weight in this model. The other, I think, quite interesting thing with this fit is that the neighbour of neighbours parameter, this beta 1 n of n, is actually nearly twice as high as the neighbours parameter, which is a little bit interesting. It seems, I don't know whether that suggests that maybe if we sampled at a faster rate, that would change and move maybe, but it does seem that further levels of neighbours do have some effect. So this is all well and good. So we've got this model that works on a network. So what kind of things can we compare it to? So we have a multivariate time series, and one thing you can use for a multivariate time series is a vector autoregressive model, which basically allows every individual series to have an individual autoregressive parameter, and it allows them to have a separate parameter for each other series in terms of how much the other series affect them. So we're not taking into account sort of a network as such, we're just putting it all in, looking at all comparisons. And the other comparison we've got is separate AR2 models, which is simply ignoring the fact that we have a multivariate series at all and fitting an AR2 at every series individually, and then we're going to try the forecasting from that. So these forecasting estimates are done on the final time point. So naturally, so we input 51 weeks of the year and then try and predict the 52nd week. So from this table, we can see that actually for the mean sum of squares of the fit, the network model is further from the data. However, on the final column, which is the prediction error, we're actually closer. And there's a lot fewer parameters that we're needing to fit. So in fact, we only use 4 parameters for this model. And you assume that the network structure is sort of given. So we can see that despite the fact that other models are closer in terms of being able to fit closer, they're not better at prediction. So I mentioned a lot earlier about the trend in the series. So I also looked at lots of different ways of maybe dealing with this trend, because in a univariate time series, you would deal with your trend first. And what I found was if you do some spatial differencing and trend removal, and then forecast, we actually get really quite a close model. So we have the original on the left, the best fitting in the middle, and then just the individual AR as a comparison on the right. So we can see that the individual AR is a lot more green in the majority of the country, so it's predicting higher than it actually was. So somehow dealing with this trend, naturally, kind of allows us to forecast a lot better. So this is a very sort of brief overview of what we're doing for network time series. And we think that this has got a decent amount of potential for lots of different series and applications. We do have an amount of fitting software that should be released on R at some point. But yeah, that's the work that we've done so far. And we've got, thanks to people from the UK Health Protection Agency who supplied the MUMPS data. Thank you for listening, and thank you for the invitation.